Thank you so much for joining us here this evening. My name is Dolores O'Riordan, and I'm the Director of UCD's Institute of Food and Health. And I'm absolutely delighted that you can join us here this evening for the UCD's Institute of Food and Health public lecture. And these lectures are designed to share with you, the public, the expertise of scientists in important areas of food and health that may be concerning you. And tonight it's the very important topic of the role of nutrition during and after pregnancy. Now, the purpose of these public lectures is one, to provide you with the information, but an important element is also to be available to answer any of the questions that you may have in relation to this topic. So within the tab, you'll see the Q&A, so just keep your questions going. And when we have finished the talk, we'll then get a good discussion going, and we'll be happy to take any of the questions that you've posed. Our speaker this evening is Dr. Sharleen O'Reilly, and I'll hand over now to my colleague, Professor Lorraine Brennan, who will moderate the session and introduce the speakers to you. Over to you, Lorraine.
Thank you very much, Dolores, and good evening to everybody. It gives me great pleasure to introduce our speaker tonight. So we have a speaker, and then at the end of it, we're also going to have a registered dietitian who's going to join Sharleen at the end to answer questions. So Dr. Sharleen O'Reilly is a CORU registered dietitian and assistant professor in the School of Agriculture and Food Science in UCD. In 2019, Sharleen was awarded the Irish Nutrition and Dietetic Institute Research Dietitian of the Year, and she has a special interest in maternal and child nutrition. Sharleen has worked as a dietitian in Ireland and the UK before moving to Australia, where she was a senior lecturer at Deakin University. She's now back in UCD, and she currently leads a large European project looking to improve mother and baby health in the first 1,000 days. As I mentioned, Sharleen is going to start out and give the talk, and then at the end for the questions, which is going to be joined by Sarah Louise Killeen. So Sarah Louise is a registered dietitian and a member of the Irish Nutrition and Dietetic Institute. And Sarah currently works as a senior dietitian at the National Maternity Hospital and is in the final year of her PhD in translational medicine within the UCD Perinatal Research Centre. So it gives me great pleasure to hand you over to Sharleen for her talk.
Thanks a million, Lorraine. So I might just get started. I think in summary for what I'm actually going to be talking about today, I think this little video gives you a nice insight into the first 3 trimesters and what I'm going to call the 4th trimester of pregnancy. So sort of 6 months after the baby's born, where it's entirely reliant on milk for its nutrition. So let's get started and see how from little things, big things grow. So this first trimester is really important. It's like sort of feathering your nest. So for nutrition buffs out there, you'll know that whenever people make images of what the size of a baby is like in the womb, they always make reference to fruits and vegetables, and I'm not going to do anything different. In this case, you might think an apple is a pretty large thing for a baby to be in the first trimester, and you're actually right. So it's actually the pip of the apple. So that seed is the size of a baby at the very start of that first trimester. So how can we ensure that that seed has the right nutrients to be able to grow? So healthy eating is something that is the foundation that you need to build your diet on. And in Ireland, the food pyramid is what we use to support people to understand what that looks like in practice. So you can see here the foundation stones of healthy eating are fruit and vegetables. So you need 5 to 7 servings of fruit and vegetables every day to ensure you're getting the right balance of vitamins and minerals. And what is a serving, you might ask? Well, each of the individual pictures is a representation of what a serving is. So above fruit and vegetables, you can see the sort of brown section, and that's your whole meal and whole grain bread, cereals, potatoes. And they give you energy as well as other vitamins and minerals. Above that is your dairy category, which is your milk, yogurt, and cheese, and you need 3 servings of those in a day. And protein sits just above that, and that's 2 servings in the day. And Up at the top there you have fats and oils, and that includes your vegetable oils, your olive oils, etc. And that's in very small amounts. And this section of the pyramid is what we would call the core foods, or everyday foods, if you want to keep it nice and simple. And then cut off and sitting off on its lonesome there at the top, you can see the sometimes foods, or not everyday foods, and those should be consumed a maximum of once or twice a week. Although I know for some people it's generally part of their core food. So I think if any of us could make a right step in the direction that we need to for healthy eating, it would be trying to make these sometimes, not every day. So down the very bottom of that pyramid, you'll also see a message around drinking fluids. And water should be a good part of that consumption. And we'll talk a little bit more about that in a second. And activity and physical activity is critical. But I'm not really going to go into that. But being active during pregnancy really does help in terms of better deliveries, and also in terms of you as future parents instilling good activity behaviours in your children. So I'm going to talk about two nutrients in particular that we actively need to take as a supplement, which is a little bit different to what you might think. Oh, I can get all my nutrients through my food. So folic acid is one of these special cases. It's a supplement that we should be taking at least 6 weeks before conception to ensure that we have enough of a nutrient called folate, which is the naturally occurring version of it, in our diets, to ensure that the development of the brain, the nerves and the spine can occur fully during the first 6 to 8 weeks of the baby's formation. And we know that there are particular groups that might need higher doses. So for example, if you had a history of previously having a neural tube defect, which is, say, for example, something like spina bifida or cleft palate, and if you have obesity, or if you have diabetes, then you might need to get a prescription dose much higher than you can buy over the counter. So your GP can prescribe that for you. But folic acid at the level of 400 micrograms a day, taken at least 6 weeks before conception, and then through pregnancy and into breastfeeding, if you are breastfeeding, is the right amount of that vitamin to make sure that you get it to ensure that healthy development of the brain and spinal cord. Just as a point of reference, the UK have actually, just as of last month, instigated sort of fortification of their bread baking flour. So they actually will be getting low doses of folic acid in their breads, and potentially down the line in Ireland, we might also consider getting a little bit more folic acid into our food supply through that means. The other vitamin that we're encouraged to take as a supplement during pregnancy, and also in the general population, is vitamin D. Now, vitamin D is made through the action of sunlight on our skin. And in Ireland in particular, between October and May, we have insufficient sunlight to make vitamin D. For pregnancy, we recommend 10 micrograms or 400 international units of vitamin D is supplemented every day. And vitamin D, together with calcium, goes together to make strong bones and teeth in the baby. And we know that if you don't have enough vitamin D, that it can be linked with a condition called preeclampsia, or dangerously high blood pressure in the mum, or potentially muscle spasm in the baby at birth, or an increased long-term risk of asthma in the child. So I did say that I was going to mention about drinking. Unfortunately, it's not about alcohol, because alcohol is actually something that we would avoid during pregnancy. And that's for very good reason, because it's linked to developmental problems in the baby. But thirst is not something that is a good, reliable indicator of having enough fluids. So what we would recommend to mums is that urine is actually a good indicator of how hydrated you are. So that if your urine is a nice pale colour, so have a look the next time you go to the loo, and if it's a nice pale colour, practically transparent, it means that you're well hydrated. So going to the toilet 3-4 times a day is probably a good indicator that you're having enough fluids. If a mum is being really physically active or in a warm working environment, then she might need to have more fluids during the day. Caffeine is something that over recent years we realized is linked to complications in the baby. So it's now something that is recommended that is limited. 200 milligrams is the limit that should be consumed during a day. So that's about 1 to 2 caffeinated drinks. So you can see here from the table that, say, for example, if you had a mug of tea and a bar of chocolate, that you'd be hitting 100 milligrams quite easily. So definitely something worth considering if you are somebody who likes a lot of tea and chocolate, for example, that during pregnancy, it's something that you would have to watch. So there are a few other foods that you do need to avoid during pregnancy. And the reason is that they are linked to things like stillbirth and also other complications. So for that reason, it's best to steer clear of them so that you just don't have those problems. So it's things like undercooked meats or raw cured meats like salamis, any unpasteurized milk, things like farmers market cheeses that might have used a raw milk to make them, liver or any liver products, any cod liver oils or fish liver oils, any pâtés, any mold ripened cheeses or ones with veins through them, any raw milk cheeses, any ready meals that you might buy over the counter that you have to cook yourself that you mightn't be sure are fully cooked through, or any raw or undercooked eggs. So things like the runny poached eggs or, say, cake batter shouldn't really be consumed during pregnancy because they are a risk for salmonella. Similarly, at the very end there, you can see your heavy metal risk fish, which are your shark, swordfish, marlin, fresh tuna steaks, as well as raw shellfish. So things like oysters should all be avoided. Food safety is really important. So things like washing your hands before you prepare your food, preparing meat separately to vegetables, or fish separately to other items. Cooking food all the way through is really critical for things like pork, chicken, etc. And then, say, for example, if you have prepared a meal and you want to have leftovers, making sure you chill it down quickly in the fridge, and that if you do heat it up, that you heat it up until it's piping hot all the way through. So let's move on now to the second and third trimester. So you've moved from a lovely nectarine to finally into sort of cauliflower territory into the third trimester. And so at this stage, you have a growing baby, but you also have a growing mum. And for that growing, you need to gain weight. And most people are generally very surprised to learn that the baby is only a quarter of the weight that they've gained. They're like, hang on a minute, that can't be true. But it is. And another quarter of what you gain is the blood and your body fluids that you need to help fuel that circulation between the mum and the baby. And then the other half is all the storage compartments that are to feed and fuel those two systems. So to fuel the system, you need to balance where you were at when you started. So say, for example, if you started being underweight, you're going to need to build more stores. And so for that reason, we would need mums to gain more weight during pregnancy. Your average mum needs to gain between sort of 11 kilos and 16 kilos in her total pregnancy weight gain. And similarly, if somebody starts at a higher weight, they need to gain less because they have a little bit more storage to pull down on during the pregnancy. So in that second and third trimester, the ideal thing is that if you're going to need more energy, that the energy that you choose has extra nutrients so that you're getting more sort of bang for your buck in your snacks. So these are ideas for types of snacks that would be nutrient dense, but also have, easy to consume during that time and fit in during, somebody's busy day. So one of the common things that people do experience during pregnancy, particularly in that third trimester, as the pregnancy hormones shift, is that constipation. And I think that picture says a lot. So fiber coming from whole grains, fruits and vegetables, is really helpful to get the bowel moving again. In particular, making sure that the mum has plenty of water alongside the fiber is really important, because one without the other actually doesn't help. And also physical activity helps to stimulate that bowel as well. So going for walks alongside those snacks will help fibre be the friend that you really need. So in terms of nutrients, there are some particular nutrients, particularly in this second and third trimester, that are important. So dietary fats and the omega-3 fatty acids help reduce preterm birth, and they improve the brain development and eye development in the baby. So for that reason, the recommendation is 1 to 2 portions of oil-rich fish in the week. And you can see the examples of commonly consumed fish here in Ireland on that list. Iron is another nutrient, particularly in the third trimester, that becomes increasingly important because the baby starts to lay down its iron stores in that third trimester. And as I said, that blood volume really increases for the mum because she's having to grow that baby. Now, our bodies are really, really clever. They're able to increase the absorption. So at the start of a pregnancy, a mum only absorbs about 7% of her iron, and it goes all the way up to 37% in the third trimester. There are 2 types of iron that you can get from your food. There's heme or animal protein sources, or non-heme sources, as you can see listed there. The thing with non-heme sources is that they're a little bit less available to our bodies. So things like inhibitors are more effective at stopping their absorption. So we need to be conscious that we don't consume them alongside the non-heme sources. So hopefully mums will be reducing their intake of tannins anyway, because they contain caffeine. And so the other thing that they can do if they're consuming the non-heme sources is eat a vitamin C rich food alongside. So that could be something like orange juice, berries, kiwi fruit, or a tomato sauce or tomato salad, etc., alongside those foods, which will also increase that absorption. So 2 other nutrients, just to get them in there, which are rich in dairy foods here in Ireland, are iodine and calcium. And we know that iodine is really important in pregnancy because it helps the baby grow and it helps the brain to develop. And we need to take 2 or more servings of milk or yogurt in a day, and eat white fish once or twice a week to be able to get in sufficient iodine. And then calcium is 3 servings of milk, cheese or yogurt, or even fortified plant-based alternatives on a daily basis. Right, so I've talked a lot about pregnancy. Let's move on to the 4th trimester, as I mentioned at the start. And because we're so close to Halloween, I thought, why not use a pumpkin? And it's a pretty cute pumpkin baby there too as well. So this period of life is all about getting the best start to life. And the infant feeding guidelines, as per the WHO and what the HSE has adopted here in Ireland, is that exclusive breastfeeding for the first 6 months of life is actually the best start for a baby's life. And that continued breastfeeding for 2 years and beyond with complementary feeding is actually the way forward in terms of infant feeding. Now, the 2 pictures that you can see there are my 2 little tots that are not so tiny anymore, but that's my son in the corner and my daughter up in the far right-hand corner. They were both 5-pound babies, so not very big ones, but you'll see pictures of them at the end. Yeah, they're 10 and 12 now, so a bit bigger. So let's get down to business, and breastfeeding is everybody's business, and for a very good reason, because if we have more breastfeeding, we have improved health and development in our children. So breastfeeding is going to provide appropriate nutrition at every developmental stage. It means that children will be less constipated and have fewer feeding issues, also while breastfeeding, but also thereafter, so while they're actually consuming normal food. We know that it's associated with less sudden death syndrome, or SIDS. It's associated with less acute illness, so things like inner ear infections, but also long-term illness like obesity and diabetes. it's associated with improved health outcomes in women. So for women, less diabetes, less heart disease, less breast and ovarian cancer, increased return to pre-pregnancy weight, and better pregnancy spacing. So all those things go together to make the children have improved cognitive outcomes, better learning, achievement, and increased productivity gains on the side of the child, but then also on the side of the family from the mother and partner perspectives. Because the child is less sick, there's also increased productivity gains to be had from their perspective, which in turn means that there's growth in the economy in the long term. So it's a win-win from that kind of long-term perspective as well. So while the WHO and the HSE and our national government would like to see more breastfeeding happening, we actively have a problem here in Ireland insofar as we only have just under 64% of mums have tried any breastfeeding when they're leaving the hospital on average. And of that, 37% is exclusive breastfeeding. So we're a long way off what the WHO wants us to achieve. And unfortunately, once you leave the hospital, that rate just continues to nosedive basically in Ireland. So in essence, at UCD and also with our partners, the National Maternity Hospital, we're very interested in learning about what can we do to try and improve breastfeeding rates. And even within that group of breastfeeding women, there are some that are particularly at risk. So we know mums that come from lower economic backgrounds, in particular in Ireland, people from travelling communities are particularly at risk. Mums that have higher BMIs so are also at higher risk, alongside mums that have diabetes, either in pregnancy, type 1, type 2, or gestational diabetes. And the reduction can be up to 30% compared to the general population. So the reason that it's such a challenge is that breastfeeding is not just one thing. It's a continuum. So it starts in pregnancy and goes all the way through till when the breastfeeding actually stops. So, and at each stage, there's different things that somebody has to learn or know how to do. And so for that reason, it can be quite a complicated thing to intervene in and help support somebody with. But we're trying to learn about what interventions actually work. So there's been a Cochrane systematic review, which would be a very high-level systematic review of all of the evidence. And what they were able to come away and say is that if you have a health professional doing education or a non-health professional doing counselling or peer support, they can help improve what's up the top. You can see their initiation. So that's actually getting the baby to the breast and starting that breastfeeding off. So those things work to get breastfeeding started. And then what also works to support breastfeeding keeping going is making sure that it's part of the everyday care that people are going to have, that there's things like scheduled visits, that we think about what are those tailored needs that people might have, that we think about the mix of who's delivering that care. And then if we want for exclusive breastfeeding to happen, we critically need to have face-to-face support. And if we do those things, we can see significant improvements in breastfeeding. And then actually just during National Breastfeeding Week there at the start of October, myself and 2 dietitians published a systematic review where we looked at 3 of those at-risk groups to see if interventions actually worked in those groups more effectively or less effectively. And what we were able to see there is that there was a 2-fold more likelihood that somebody would be exclusively breastfeeding if they got an intervention. And they would be 43% more likely to be breastfeeding at 6 months. So definitely interventions work if we can get them there and happening in the settings that women are experiencing their care, like maternity services and outside of them. So with that, I'd just like to highlight that there is a study going on in the National Maternity Hospital So if you are interested in that and currently pregnant, we'd love to hear from you. So breastfeeding is perfect nutrition, and I love the fact that breast milk is something that can actually change and adapt as the baby grows. So once the baby is born, you start producing a substance called colostrum, which is our first milk, and it's a really thick colour. And what it is in essence a really intense shot of immune nutrition. It's high in fat, it's high in protein, and helps to give the baby a really quick kickstart nutritionally. About day 3 to 5, the mum's milk starts to change into her more mature milk. And this is really quite fascinating because the milk adapts in itself. So each feed starts with foremilk and then moves into what you can see in the picture there as hindmilk. Foremilk is really hydrating and helps to quench the baby's thirst. And the hindmilk is actually really high in fat and helps to quench the baby's hunger. So you can see in terms of composition, the foremilk looks really quite watery. It's high in lactose, which is a sugar. It's high in human milk oligosaccharides, and these are tailored minutely down to that baby to meet their needs. And we know that from doing compositional studies. And then the hindmilk, in terms of the fat composition, again, is tailored as it weans towards that hindmilk. So the other thing that's really, really fascinating to me anyway about human milk is that it is a real true superfood. So in terms of the composition of the milk, it has antibodies, and we actually know that now with COVID, if a mum has had COVID, she passes some of her passive immunity from COVID to her baby through the breast milk. It passes all of these other active compounds. It helps to mature the baby's gut. It helps to ensure that there's essential fatty acids going through. There is also a really interesting part that we're only starting to understand about human milk, and that is that it's not sterile. It contains bacteria, viruses, fungi. It actually doesn't pass SARS-CoV-2, which is great. But these non-sterile components help to stimulate the baby's immune system, and we think that it helps to prime the baby to protect itself. So it's another way of priming their immune system. So it really does do quite a lot. So with breastfeeding, I'm not going to go into this, but latching is the key to success. And I think if your baby looks like Pac-Man just before he latches or she latches on, I think you're halfway there. So a nice wide mouth is one of those key things, but those steps hold true. And if you do need support with latching, definitely get yourself the right person. Would be a lactation consultant or a midwife, and they have the right skills and the patience to sit down with you and support you with your latch. And from a nutrition perspective, the key things to remember is breastfeeding is a skill. It takes time to learn, so be patient with yourself. Small, frequent feeds are the key thing that you need to remember that are going to be the mainstay of your nutrition for your baby. Cluster feeding is normal, so around sundown, that baby will feed more frequently. So it's very typical that the baby will feed in small blocks more frequently. Typically around a growth spurt, the baby will feed again much more consistently and a lot more often. And they tend to be in sort of 3-week blocks. How you can tell your baby's getting enough nutrition is through wet and dirty nappies. And my sort of top tips around feeding are never quit on a bad day. Every breastfeed makes a difference. And more feeds is absolutely not a sign of insufficient supply. So in terms of outside of all of breastfeeding things, vitamin D is something that kids are at risk of deficiency for. So babies do require vitamin D drops. You can get these at the pharmacy, and if a formula-fed baby is only taking less than 300 mils a day, they also need drops. Iron shouldn't be a problem because breast milk contains a protein called lactoferrin, and it has really high bioavailability for iron. But it's only when a baby starts to wean that it needs to be thinking about iron-rich foods. So for you or any woman here that's breastfeeding, a varied diet should hit all of your nutritional needs. So again, that food pyramid is key. Oily fish is one of those things that you do still need to consume. Fluids, you will be really thirsty, so drink plenty of water, limiting caffeine and alcohol because it passes through the breast milk. And there's some more information around things that are essential versus non-essential. But as I said, a balanced diet will hit all of those dependent nutrients. If you are formula feeding your child, standard formula is all you need. You don't need follow-on milk, extra hungry milk. Any of those things are not required. Formula is only required for the first 12 months of life. You need to buy the equipment to make up the formula and the powder, and only make it up as per the instructions. No extra scoops or any other additions to the milk. And then last but not least, in terms of feeding, there is a move towards trying to teach babies who are being formula fed to feed in a more breast-like manner. And by that, it's called paced feeding, which is about trying to keep the baby a little bit more upright, using the bottle straight into the mouth as opposed to tilted upright, as you can see there with the X on it, using a slow teeth only, building in regular breaks to the feed, making it social, keeping the baby close to you, inviting the baby to open its mouth before it feeds. And then if the baby shows signs of being full before it finishes the bottle, then don't finish the bottle. Just because you made it, it doesn't mean the baby has to drink it. I think that's a social thing that we feel because we've made a bottle, the baby needs to finish it. Teaching the baby to respond to its feelings of satiety will last it much longer and do it much better in terms of health, because it will learn to respond to when it's full. And that's a life skill that's really of benefit to the baby. So in summary, the healthy eating guidelines are critical for pregnancy, breastfeeding and beyond. Alcohol and caffeine are best avoided in pregnancy and breastfeeding. Food safety is really important in pregnancy. Drinking plenty of water is super during pregnancy, breastfeeding and beyond. And human milk is the best first food for your baby. Thanks very much. And just to show you, I did say I would show you pictures of my two as they started to wean and have food. So they're my daughter at the top and my son down the bottom. And those sites in the middle are vetted, good evidence-based sites to encourage evidence-based choices around food and nutrition for pregnancy and beyond. Thank you.